I will record from my side also. Yeah, so change from baseline calculation we are doing. So what do you mean by change from baseline calculation? It is very important in the clinical trials when you are preparing the tables. Okay, so you know, right, usually we will be creating two types of the tables. Okay, so what type of tables we will be creating? Usually demographics as I told you yesterday, safety and efficacy tables. So these are the three types of tables we will be creating in the final study report. Okay, then how can you find the efficacy, whether your drug is effective or not? So how to find the efficacy determination. Okay, can't you hear me? Oh, hello. Hello, but I can hear you. Krupa, can you hear me?
Yeah, I can hear.
Yes, right?
Yeah.
Sorry. Hello. Now can you hear me, Kruna?
Yes, I can hear you, but I cannot record the lecture.
Yes. But when I make you the organizer, then we are losing that audio. Okay, no problem. I will send you this recording. Okay. Yeah, fine. So we'll see the efficacy. I'm talking about the efficacy. So we have three types of tables: demographic, safety, and efficacy. How the efficacy is measured means efficacy is measured based on the baseline calculations only. So it's measured by change from baseline calculation. Change from baseline. Yeah, I'm recording. Change from baseline calculation. Okay. So usually for this purpose we'll use the change from baseline. Okay, let me tell you. For example, a patient is having the blood pressure, systolic blood pressure, initially 160 or 180. Then after 1 month of treatment, okay, after 1 month of treatment, maybe the trial duration is 6 months. Okay, 6 months is the trial duration. So what is this 180? It is a baseline. Means initially blood pressure is 180, then after 1 month of treatment showing 150, then second month then it is showing some 130, then it's a third month it is showing as 120, then it continued like fourth month, okay, same 120, then fifth month also it's showing 120, then sixth month also it is showing as 120. So how can you measure the efficacy here? So change from baseline. So what's the baseline value? 180. Then what's the change after 1 month? So it's first month 150. So 150 minus 180. So there is a reduction of minus 30. So 30 decreased. So it's effective. Then here 130 minus 180. So it should be the 50, right? So minus 50. Second month 50, decreased. Then 180. So it will be the minus 60. Later in the fourth month, same minus 60, it got stabilized, minus 60, then equal, right? Here it is same, minus 60, here also it is same, minus 60. Then how can you, I mean, say that the drug is safe, I mean drug is effective? Just by calculating, we can say that the drug, you know, it worked efficiently, and it won't need the 6 months of the drug also. If we can give the medicine for 3 months, then it will I mean control the BP and it will regularize the BP. So these type of answers we can do based on this result. Means to prove the efficacy, every time we'll be using this type of the calculation only. We should have the baseline values, and after giving the medicine, then we'll be collecting the values. So change from baseline, these values always show the efficacy of the drug. So whenever you face any interview or any question, what are the efficacy tables means, whatever the table may be, but the primary thing is change from baseline calculation will give the results of the efficacy. So when we are discussing the final study report, then that time I will show you how to do that. But how to calculate this change from baseline, I am showing. But first of all, you should understand what is the baseline and what is the follow-up value, what is the screening value. So these things you should understand first. Let us see. The same example I am using. According to the protocol, the people or the subjects or the patients who are having blood pressure of more than 150 mm, okay, 150 mm Hg are eligible to participate in the clinical trial. This is a protocol requirement. Okay, means those who are eligibility criteria. We call it the eligibility criteria in the protocol. They should be, I mean, they should contain, I mean, they should have the blood pressure of more than 150. That is the eligibility criteria. Later, we are doing some screening test. A patient came to the hospital and we screened the blood pressure on 17th January showing 180. See, this is a normal I am talking. This is a normal, and this is a protocol requirement. The patient visited on 17th January showing 180. Then again he visited on 18th showing 170. So continuously 4 days we collected we measured the blood pressure. Why? Because some test will be there. So just with one test we cannot confirm. Okay, we cannot confirm the disease because there are so many factors. Even I saw so many patients, you know, first time when they undergone the diabetes test, their results were showing some 200-300 milligrams of sugar. But later on, so they undergone the test so many times, but they didn't find, I mean, they didn't have, I mean, there is diagnosis to have any diabetes. Okay, sometimes it may happen. Maybe there are so many factors are there. Here the blood pressure also, when you feel, you know, tension, or when you are in hurry, okay, or when you're walking or do more exercise, or you take you know, more salty content on that day, then automatically your blood pressure will be fluctuated. So these things may happen. So when a patient visit on 17th January, might be he is afraid of that new environment, so blood pressure may be shown as 180. So we asked him to come on the next day. So we collected all these. So these are all the screening values. We consider these are all the screening values. Okay. Then which one we used to calculate? Okay. So these are all the screening values. So we collect the information from the patient like 7 days. But on 5th and 6th, the patient was absent. Though he was absent, just we made a list like this. Now, dose given to the patient, considering all the baseline, no value showing less than 150. So just by looking at this, we consider him as the hypertensive patient, and we give the medicine on the 23rd January. So he the dose given to his, the dose given to the patient on 23rd January. Then which one will you consider as the baseline? Baseline means the value which we use for the calculation purpose, that's called the baseline. Okay. So which one from all these will you consider as the baseline? I am considering it's 160. Why 160 not 180? Because the dose given date value should not be considered. Why? Might be you have collected after giving the dose. There is no time, right? So we should not take this one. Then on 22nd he was absent. Then where is the value? On 21st also he was absent. Then what's the recent value? That is 20th January. So we'll be considering this 160 as the baseline. Means this baseline value is used for the calculation purpose. So what's the baseline? 160. Then Why don't we consider 170? Because the most recent value you have to consider. Okay, but if this value also not there, then we can consider 170. If 170 also not there, so can we consider this 170? No. Why? Because there is some limitation. Within 5 days, the values are acceptable as baseline value before giving the dose. So the dose given on 23rd, so the value should be before 5 days. So 1, 2, 3, 4. I mean along with this. So 1, 2, 3, 4, 5. We'll consider up to the 17 only, but within 5 days. But those values you should not consider. Got it? I mean, this is, I'm talking about the blood pressure, but the values should be considered or not to be considered. It depends on the test or depends on the that particular study. Okay, but here in this case, within 5 days the values are acceptable. Got it? Why 5 days? Why we should not accept the 170? Why not the 7th day? Means there is some limitation. Okay, just I will tell you a small example. Don't think that I am wasting the time. Just I mean, just for your understanding, and definitely it will help you to answer. Okay, when you face this question. See, for example, a student in the unit 1. Okay, I'm just giving this example. In the unit 1, student got 20 marks. Okay, in the unit 2, again the student got 30 marks. Then unit 3, he got 10 marks only. Then we thought that he's not improving, so that we arranged some tuition teacher or some trainer. Okay, some trainer we arranged. After 1 month of coaching, then in the unit 4, the student got some 90 marks. Okay, so is there any improvement? Yes. How much improvement you saw in that student means, usually what we do, we won't take this 20, 30 or 10. Okay, we'll take the 10. So before tuition he got 10 marks. Then after tuition he got 90 marks. So 90 minus 10 is the change from baseline. So just because of tuition he got 80 marks more. So this is our interpretation or calculation. Then if the student was absent on the 3rd unit, then usually what we do, we'll take this 30. Okay, because the very recent value we'll take, that will be the 60. Though the tuition made him to get 60 more marks. Then if it is like this, the recent value, because recent knowledge we are testing, so he got 20 only, the one which he appeared. Okay, so because of tuition he got 70, but he doesn't appear the 1, 2, 3 and exams also. So directly here we made a tuition. Then how can you calculate the change? Okay, maybe it is some 6th standard. So can you take the marks of the 5th standard? No, right? So you won't go to the 5th class. Okay, that's a limitation. Got it? There is some limit, right? So up to 5 days those values are accepted. Beyond that we should not accept those values. Okay. Okay, fine. What are we just see 160?
Kiran?
Yeah.
Hello?
Yeah, I can hear you.
It's Kunal. Sorry to disturb you.
Yeah, no problem.
So who is responsible to take the baseline value? I mean, SAS programmer, or we have been given to
no, actually it will be there in the SAP only, statistical analysis plan only. Okay, in the statistical analysis
so everything is in
yeah, everything will be there in the statistical analysis plan only. One second, I will show you one SAP, because in your meantime, if you can go through that, then you will get more the understanding. I will tell you. So there is a site called the sapmaker.com. Okay, just go to this site. Okay, sapmaker.com. In this there is a statistical analysis plan is there. Okay, then it will show you what is the content of the statistical analysis plan. Okay, study synopsis. The statistical analysis plan should contain the primary objective, secondary objective. For example, you want to know what is the safety population. Okay, just click on it. Then it will give you the information about the safety population. Means discuss safety population who had at least one study medication. What do you mean by safety population? There are 2 groups of the patients who enrolled in the clinical trial. So to one group you are giving the medicine, to other group we are giving some other medicine. Means it's a what we call it as a randomized control trial or active drug control trial. Means we are giving to two groups the active medicine only. Okay, means medicine A, medicine B, we are giving to two groups. So I mean any group that is taking the medication is considered as the per protocol. Sorry, safety population. Okay, safety population. Then intent to treat means here it is showing. Analysis by intent to treat is a strategy that compares the study groups in terms of the treatment to which they were randomly allocated, irrespective of the treatment they actually received or other trial outcomes. Regardless of protocol deviations and participant complaints or withdrawal, analysis is performed according to the assigned treatment group. Got it? So this is called the ITT population. ITT population. So these content will be there in the the SAP. So you should know each and every part of the SAP for your the table or any ADAM SDTM data preparation. Okay. So my suggestion, just my advice is just go through this SAP and read each and every part of this SAP. Okay. So what is the primary objective? So what is the primary objective here? What is the secondary objective? Then what are the demographic table? Here, one second, adverse events are safety, efficacy parameters we are checking. In the efficacy parameters, you see the primary methods for analysis of efficacy. I told you, right? What is the method of checking the efficacy? So it is just okay, let's take the binary data. Then it is showing what's the binary data here. Okay, so it will give you the meaning of each and every part of the SAP. Just go through this sapmaker.com, means sapmaker.com. Okay, go through it, and if you have any doubts, you just make a note. We'll be discussing them. Okay. Okay. Now, okay, so here we give the dose on 23rd January. Then initially baseline we are making as 160. Then after 1 month of treatment, blood pressure was showing 120. So 120 minus 160. So the change from baseline is 40 minus 40. How we are calculating? Final value 120 minus initial value 160 is baseline. I mean initial value is nothing but the baseline, right? Initial value, or we call it the baseline. So final value minus initial value or baseline equal to result. That is change from baseline. We are taking one more example here. Hemoglobin. Hemoglobin. So the anemic patients, those have the less blood percentage. So it's a 90 days course. Dose given on 1st January. Then dose given on 1st January. On dose given day also we collected the information. And 31st December 7.8 and then 30th December 8. So dose given date we should not consider as the baseline. Just one day before the dose given we should consider as a baseline. Then before values are all the screening values. So 7.8 is the baseline. Then after 1 month follow-up showing 8.2. So 8.2 minus 7.8. The change is 0.4. Means the 0.4% increased. Okay, 0.4 not percent, 0.4 grams increased. Then 9.1 in the second month, second follow-up. So 9.1 minus again baseline. Means we are talking about the change from baseline. It's not the difference between first visit and the second visit. Always we are calculating the change from in the baseline how it was, and second week how it was, and third week how it was. But we are not making the calculation between the first week and second week and third week. So never calculate what we say the follow-up to follow-up. We calculate always from the baseline only. Okay, so it's a 9.1 minus 7.8. It's 7.3. Again 10.2 minus 7.9. There's a final change from baseline. So the total increase of the hemoglobin concentration is some 2.4 because of this 3 months of the or 90 days of the course. Okay, so this is how we are calculating. But these are all manually we are doing, right? But we have a lot of data having multiple patients, so it's not possible for us to do it manually. So I'm doing it with the SAS. See, these are all the standard things what we are discussing. Okay, because for every topic, there is a SUJI paper. You will find the SUJI paper because it's a common clinical programming what we are learning. See, for example, here change from baseline calculation. Okay, there are some papers. One step change from baseline calculation. Open it, and this is SUJI paper. You download this one, then it will help you to understand what the change from baseline. It's a common one in the clinical, so it will help you to understand better than what I explained. Okay, so you can find more papers like this only on that particular topic. Not only, I'm explaining all these steps, right? For each topic you can find a paper there. Okay, you just go through them. Yeah, so I'm creating a data set. Yeah, now I have a data set like this. I sorted it, okay, and I printed. So this is the data I have. So this is information about only 2 patients. See? 101 patient. 0 week means baseline. Baseline having 160 systolic blood pressure. Then in the first week systolic blood pressure 140. What's the change? -20. Then the second week systolic blood pressure 130 means 30 is the change. Then the third week systolic blood pressure 120. So 40 is the change. So for 101 patient, only if you take the systolic blood pressure, first week 20, third week, second week 30, and the third week 40. So this is the change. Okay, so first we are sorting based on the test. Okay, because we cannot make the calculations like this. So based on the test we sorting. Now just giving all the diastolic blood pressure as a one group and systolic blood pressure as a one group of this 101 patient. Now you can do it simply here. What's the initial? 0 means initial 160. First week 140. 140 minus 160 20. 130 minus 160 30. 120 minus 160. It's a 40. You can calculate like this. Okay. Now I wrote we have a program here. So I'm not going to explain the program because this is a very base SAS only. So you need to check that one. Submit. Now see the output. It's giving you the change from baseline. Okay, so what's the change in the systolic? I'm just taking only one. Initially baseline is 160. -20, -30, -40. So in the first week -20, second week -30, third week -40. Coming to the diastolic, then in the first week -3, -5, -10. To the second patient it increased 5, 10, 15. Initially the diastolic was baseline was 75. Then again value became 80 and 85, 90. So it increased. Here also it's increased. Baseline 141, 0 week. Then became 161, 171, 181. So every time 10, 10 increase. So 20, 30, 40 like this. So for one patient it decreases the values, and for one other patient it increases the values like this. So this is a change from baseline calculation. Okay. Now let us see one more topic, that is finding the outliers. You know this one, right? So it's a common in the clinical how to find out the outliers. Outliers means extreme values will be finding when you are analyzing the data. So just because of one extreme value, the values will be like a left-sided or they will be skewed to the right-sided. This may happen. Okay. Just with one mark you will pass, or just with one mark you will get the distinction also. So these things will happen. Okay. Let us see what this is. We are finding the outliers. Outliers means extreme values. So I have one data set here. See, everyone got 50, 52, 55, 50, 58, but these 2% got 110. 1% got 100 and 1% got 10. So here we are including the extreme lowest value and extreme highest value. Then calculate the means. Calculate the means. Now what the means is showing, the average marks got by the person was 53, but it is more or less equal. See, 50, so 53, it is applying to this, it's fine, it's also fine. Means when you are calculating the means of these 7 people, So this value is almost equal to each and every value except these two. Okay, but at least it is applying to 5 values. Okay, because we are using the extreme lowest value and the extreme highest value, or else, I mean, in this case it's not giving any error. It's fine, it's acceptable only. Okay, but in some situations, you know, I mean, it is not making any changes or result. But if the data is like this, okay, a person got 50, the second person got this 52, and the last person got 200, then we are calculating the mean. Okay, so what the mean is showing here, 77, means average, on an average each student got 77. But is it true? This person got 50, it's not 77. This person got 52, not 77. This person got 200, not 77. Means mathematically it is correct, but it's not correct statistically. Statistical means we have to think logically. Whether really anybody got 75, we are giving the average that student got 77, but nobody got 77, right? So mathematically it's correct, but logically it's not the correct, or statistically it's not the correct one. Then when you're doing the analysis, you have to find out the outliers and delete these type of the outliers. See how this is going. It's going to the positive side or negative side? Going to the positive side. What is it? I mean, positive side means it's a positively skewed, or we call it as right skewed. Right side is moving. Means actual data is having 50 only, but is moving up 77. Means the you know, I mean, in the speedometer, you know, that indicator is going up, right? Going up means it is going to the, not to the left side, it's going to the right side. Okay, so we call this as a right skew, right skew. Okay, so this is wrong. So you best you delete the 200 and then do the analysis, or else you see this one 50-50, a person got 1. Okay, then when you do the calculation, then it is showing you 44. So 44 also, it's not like related, it's a left skew, means the indicator is coming down, it's not in the center. Okay, it's a left skew. So to avoid this, usually what we do, we use some procedures called the univariate to find out the outliers. When you use the univariate, then it is showing the extreme observations, and what the extreme observations are there, you just remove them. Okay, so it will show you here, these are the extreme observations. In this case, remove that one. Okay, using the univariate, you can find out the outliers. Clear? Now coming to the missing values. Missing values also play an important role, okay, in the clinical. Let us see what the missing values do. For example, there's a class of 4 people, 2 male and 2 female. Okay, 2 male and 2 female. So I mean, on some specific day, somebody came to visit, and he noted the strength of the student in a percentage. Then female 2, so female 50% and male 50%. Then there is no error in noticing that, I mean, noting that points. Okay, 50-50, 50 female, 50 male. Here it's correct. But some other day, or when somebody visited, one is missing, or one male is missing. Then we are doing the analysis, or we are calculating it. Okay, so while calculating, I am using this missing. Then it is showing female 20%, 50%, then male 25%, and 1% is missing. I mean, 25% of the data is missing. Is it correct or not? It's correct only. Why? Because when there is a missing value, you are keeping it as a missing. Means while analysis, you are not. Are you considering this missing or not? Means we are considering it as a missing. Okay, we are considering it as a missing, and when you are calculating it, it is giving the correct output. Means when you see the female, it is showing 50%. That's correct. Obviously, it's correct. But you know, if you don't use this missing and just simply do the calculation, then what the calculation is showing? Female is 66% and male is 33%. Is it true? It's wrong. It's wrong because we are excluding that one and adding that 100% to both the groups. So it's wrong. Means it's a logic thing. It depends on the statistician plan only. All these things the statistician will prepare the plan based on all these things. Okay, so missing value should not be, I mean, should we consider the missing values or we should not consider missing values? It depends on his interest or based on the study. Okay, now, okay, I mean, instead of doing all these calculations, in the place of missing, if I use X, means I'm imputing, let's call it imputing. I'm imputing some value called the X. Okay, then calculate with the missing, you will get the same output, that is male 50, 25, I mean female 50%. Then don't use this missing and submit it, again it will give you the same female 50%. So there won't be any error. Means in the place of missing values, if you input something, okay, then it won't give the errors. Okay, okay, let us see this example. Then there are different imputation methods out there. Imputation method means in the place of blank, I mean if you are doing some calculations on the missing value, then obviously your result will be missing or you will get the erroneous result. So you have to add some value in the place of missing. Okay, there are different types of the imputation methods: LOCF, BOCF and WOCF. These are three types of the imputation methods. We call it as a last observation carried forward, baseline observation carried forward, and it's the worst observation carried forward. Okay, then even you can find here there are some papers on this imputation methods also. Imputation, yeah, you can see in statistics, imputation is the process of replacing missing data with some substitute values. Then how to do this imputation in the clinical? You just search it, you will find some papers on this imputation. Okay, let me explain the imputation methods here. First, I will make you clear about the imputation methods. Yeah, this is one paper, LOCF method and application in the clinical. Okay, how we have done this LOCF. This is one paper. Okay, so yeah, this is one small paper on imputation methods. You know how to measure the pain? Actually the pain is measured in different units. Okay, but here they are using some NPRS, numerical pain rating scale. Okay, you know arthroscopy, right? Arthroscopy or arthroplasty. So usually knee transplantation, right? Knee transplantation means almost they will remove, they will cut the complete knee, right? And they will keep some artificial knee, I mean the joint replacement, right? Knee joint replacement. So see, I mean when you, I mean hit something, you know, then definitely you feel a lot of pain when you with your, I mean some bone like content, but the muscle pain you will get, right? So but while doing the knee replacement, they will, you know, they will use the hammers, hacksaw blades, they will, you know, cut and remove that complete part. So it will be very painful. Painful means though they give the anesthesia, the pain may remain years together also, the knee pain. So what they do to, I mean like tolerate that pain, usually currently in the market there are only single dose medicines are came. If you take that dose, then for the next 6 months you won't feel any type of pain. So those powerful medications are came into the market. And even, you know, I think recently one of my sister, she undergone surgery. I mean the same like what we say, some she had a broken I mean the hand. Okay, so they added some plaster and they kept some plaster on her backside, okay, on her shoulder. So that plaster contains the medication. So slowly it is observing by the body and it is reducing the pain. Means internally she has taken nothing, everything like observing only. Means everything they are applying on the skin, then it is slowly diffusing into the body. So I mean very advanced you know techniques came. Okay, leave it. But the pain is measured in the NPRS. NPRS means a numerical pain rating scale. So there is a scale. So I mean to measure the pain. So here I am explaining the same content. Yeah, we're talking about the imputation methods. So There are three types of the imputation methods commonly used: LOCF, BOCF, and WOCF. LOCF means last observation carried forward, BOCF is the baseline observation carried forward, and WOCF is the worst observation carried forward. Okay. Now let us see the scenario here. 4 patients. Okay, 1, 2, 3, 4. First patient came with the 9 units of pain, means more pain. The maximum we have given 0 to 10 only. Pain intensity. 9 means more intensity. Then we have given the medicine to all the patients. Second week became 8. Fourth week became 6. Slowly pain reducing. Sixth week 3, 5. Then 8th week 3 and completed successfully. End of study status completed. Second patient, first 8. Second week, though he's taking medicine, it became 9. Again it came to the 8. So lack of efficacy, he withdrawn from the study. So lack of efficacy means there is no data in the 6th week and 8th week because of his discontinuity or disposition of the trial. Then coming to the third patient, initially 8, then second week it became 3, but he experienced some adverse event, some side effect or some adverse event. Then he stopped the medication. So the data for the next 4, 6 and 8th week will be the blank only, missing only. Then fourth patient, initially 7, then 5, then 4, then 2, last to follow. Then we missed the patient, means patient absconded, or we lost the patient when we don't know where the patient went. Okay, so missing value. Can we calculate on this type of data? No. Then the statistician will tell you, okay, which method you have to use, whether to use the LOCF, WOCF or BOCF. Based on that plan, if I am using LOCF, LOCF means last observation carried forward. What's the last observation? You just carry it forward. Here the 8 is the last one, so place the 8. It's a 3 is the last one, so place all the 3. 2 is the, the most recent value or most recent occurring value, you keep it in the place of missing. That's the LOCF, last observation carried forward. If they ask us to do the BOCF, then baseline. In the place of missing, what's the baseline? Initially is 8, so keep the baseline. Here also the baseline is 8, so keep the 8. Baseline is 7, so keep the 7 in the place of missing. Then we have the WOCF. What is the WOCF? It's the worst observation carried forward. What is the worst observation? Worst means the worst observation is 9. 9. Then out of these 3, 8 is the worst. Then highest is 7. So take the worst. Okay. So this is a WOCF. Clear? I mean, here you can see there are so many issues with LOCF and modified BOCF, okay, imputation method. I mean, there's a lot about this one because it's all like a statistical one. Okay. So we don't bother about why we take BOCF only, why we take the LOCF only. Just our role is doing the programming only, not to make the research on this clinical. If you have a statistical background, if you are acting as a biostatistician, then it will be your headache. Okay. Now let us see the imputation methods. I mean, one example I am showing you. Cholesterol. Taking a cholesterol. The patient the patient has given the sample for the HDL, LDL and triglycerides. 101 patient, 102, 103. So 3 patients they have given the sample on different dates. It's a laboratory data we have. Then this is the dosing date, dose given to the patients. Okay. Then this is the okay. Now tell me, this is the sample values. Then this is a dose given date. Then which one will you consider as the baseline? Okay, let me show you. I mean, in SAS also you can open your notepad. New, you can see view. There is a tools, text editor. Okay, no, not this one. You can open one notepad also. Put it 1 second. graph output log. Text editor, no, it's not the text editor, right? It should be report editor, no. I think it may be present in some older version, it seems. Okay, fine, leave it. Now I'm taking one yeah, now see here, 101 patient, 3 tests, right? One is patient ID, subject, HDL cholesterol, then LDL cholesterol, then triglycerides, lipid profiles. So 101 patient undergone the test on 5th September, 6th September. Then 7th September the dose we have given. Then which one will you consider as the baseline? The recent values, right? So 6th September you will consider. So HDL 49, LDL 185. So it's a 49, then 185. Then we will consider 198 also. Why? Because just only one day, right? Here within 5 days it's acceptable. So 7th September means 5th September you can accept. So carry this here, means this is a last observation we are carrying forward, right? So it should be the 198. Then what about the 102 patient? Dose given to the patient on 7th October, and these are the values of 102. 7th October means 2nd October the data is there, means how many days is between? 5 days. Okay, up to 5 days we can consider. So we can take the 52 as a HDL, then no data is there in the LDL, so you should not bring this one because there's a limit. Then 360, so keep it as a missing one, missing, and then 360. So it's for the second patient. Then what about this 103 patient? Dose given on 13 November. Then these are 103. We have the values of the 13 November also. We should not take that one because dose given day we should not consider. And the remaining 3 we have. Then 13 November means 12th November you can take 32, and 240 also you can take because 10 and 13 only 3 days is there. So 32, 240, 880. And every day, I mean on first day we have taken the LDL, and the second day we are taking this triglycerides, and the third day we are taking the HDL. So I mean you are taking the values from 3 days. Okay, 3 individual samples. So what's it? 32, 240, 880. So 32, 880, 240 is the result. So our program should give like this. Okay, now this is our program. We are merging both the data sets and writing the program and then submit it. See the output. See 49, 185, 108, then 52 dot 360, 32, 240, 880. Okay, so this is the last observation carried forward code. Here nothing, we have not wrote any big code, just we merged both the data sets and we used an array, and using the return statement, it is to keep in order. Okay, then you're using first that variable. Okay, then giving the condition, it should be in between 5 days. So 1 and dose date when the sample should be in between 5 days only. Using this condition, adding the arrays and then submitting. Okay, if you want to know this program, I mean in a clear manner, then download the paper and just go through it. Okay, so this is the LOCF, last observation carried forward calculation. Okay, then okay, now windowing. What's the windowing? Deriving a visit based on visit windowing. Okay, so one second, let me explain this visit windowing also, but first I have to explain the theory and then we'll see the practicals. Yeah, the same example I have taken. It's a hemoglobin test. Okay, I mean the anemia, I mean the clinical trial is on the anemic patients. So it's a 90 days course. Giving the dose to the patient on, given the dose to the patient on 1st January. So 1st January we have the value 7.9. Then we should not consider the baseline. Then before that we will consider. So 7.8 is the baseline. Then after giving this dose, we ask the patient to come after the 90 days. Means after finishing the course, we have given the medicine to the patient and asked him to come after 90 days. But before coming, every month you have to undergo the test, hemoglobin test, to see the improvement. Okay. So every month means 30 days. After every 30 days, you have to undergo the test. When the patient visited on 1st January. Okay. So 30 days means it should be the 30th January. Then again 30 days means it should be the 1st March, because the February having some 28 or some 29. So the 1st January, 1st March. Again the patient has to undergo the test on the 90th day, that is 30th March. So these 3 dates we have given to the patient, then ask them to undergo the hemoglobin test on these 3 days. But sometimes the patient may be on 30th January, he forget that one, or maybe he's having some urgent work. So he might not attended the laboratory for the test. Then what happens? Okay, it should be missing, right? So we have given some, some relaxation. Relaxation means like plus or minus 5 also consider. Means 30th, it's no need to go the test exactly on the 30th January. Plus or minus 5 also fine. So minus 5 means 25 January. Plus 5 means 4th February. So any value which is present in between these given 10 days, that we can consider as the 1st month value. Okay. Then 1st March means not exactly on the 1st March. It's a plus or minus 5. So 24th February to 6th March we can consider. And here also we can consider the values between these dates. Okay. Now a patient visited after 90 days with bunch of laboratory results. Means maybe out of his interest he undergone the test. Okay. Or might be he forgotten this and he brought all the laboratory reports to us. Usually what we do, we sort them in a ascending order, date wise, because we have to pick the value whatever you want for the analysis purpose. So that picking is called the windowing. Okay. So you can just browse and find that paper also on visit windowing. Clinical trial visit window. Okay, so keeping patients on schedule, clinical research, issues in data collection. So you can find some papers also. Use of SAS for clinical trial management. Yeah, you just download some papers. Okay, you will find about the visit windows. Visit windows are less than 4 weeks long and are continuous. Yeah, you understand more if you can go through the books. Just I am making you the basic understanding. Okay. So this is a bunch of results we kept in a sequence. Now our role is to pick those values. So how to pick it? Using the same SAS program we are picking this. Okay, but how to pick this? Let us see here. Manually we'll see. 30th January, right? So 30th January we have this. So 10.2 is the first follow-up result. Then the value should be in between 24th February to 6th March. Search. There is no values between the 24th February. See, 19th only last. Then again he undergone the test on 23rd March. So there is no report between the 24th February to 6th March. So it's a missing only. Then what about this 25 March to 5th April? So we have the 25 report we have, 27 we have, then 28th also. So we can consider these 3. Then out of 3, which one is the earliest and first one? 25. So we will take this 12. Okay, 12, not the recent one. You have to consider the first one, because see, when you're going on a way, so your target is to get one mango. Okay, there are so many mango trees. Okay, so your target is to get a mango. Then you started walking. What do? You won't go to the last mango tree, right? So when you find the first mango tree itself, then you will just take that fruit and you are coming back. You won't do the I mean, if there is no mango in the first tree, then you go to the second tree. Got it? So here also the same. The first one comes first. So while reading, what is the first one? 25th March. So you'll be picking this 12.0 only, not 12.8. Okay, so it should be the 12.0. Okay, so yeah, I think you got it right. So from this bunch of the results, we just picked only 2. Okay, because these are meeting our windowing range. Now we have one more data. I mean, it's practically first follow-up is specification result. First follow-up should be after 30 days, plus or minus 5 is okay. Second follow-up should be 60 days, plus or minus 5 is okay. Third follow-up should be after a year. When it is a year, then we won't say 5, we'll give more relaxation, like plus or minus 15. Then it is the fourth follow-up, then that should be the fourth follow-up should be after 2 years. 2 years means plus or minus 15 also, it's fine. Okay. Now, this is the data we have. This is one data, means patient bought all the results on different dates, lab date, lab test, and lab result. We kept in a ascending order. Lab date wise we sorted. See, sorted by lab date. Okay. Later, yeah, sorted by lab date, and then this is a dose giving date. So yeah, dose date, the laboratory results date, and you should know the dosing. These two are enough, right? Yeah, dose we have given, and yeah, now tell me which one you have to pick. We have specifications like this: 4. First month, second month, after 1 year, and after 2 years. 1962, 28 September. 1 month means 30 days. 30 days means 27th September, right? So we have the 27th September. That is 11.1 will be the first follow-up. Then after 2 months, 2 months means 28 September means October, November. We should consider the November values. Number 62. Which one? Which one is coming first? 24. Because plus or minus 5 means it will be 23 to 30. I mean some first or second. So the value 24 is coming first. So we'll consider this one as a second follow-up. Then after a year means it should be 1963. But there is no data related to 63. So third follow-up is missing. Fourth follow-up is plus or minus 15 is okay. 28 September is 21 September. So 7 days. Okay, you can consider this 11.8. So 11.1 and then 11.4 and then 11.8. So these are the 3 values we are taking. So we have the data and then submit this program. Okay, now we got like this. Initial values hemoglobin 11.1. 30 days is 11.4. Then 60th day is 11.6. Then second follow-up 730. 365, 357 means second follow-up should be 11.8. Okay. So this is how we are calculating. Clear? So this is about the windowing. Okay. So yeah, we'll see this tomorrow. How to calculate the study days and time to sensor event. Yeah, I think yeah we'll finish this by tomorrow.